Welcome back, everybody, to Let's Talk About Sleep, the channel where we talk about sleep. Here's the book that I always have to show you all. The link to this, the Amazon link, is in the description box down below. As we inch towards 1,000 subscribers, once we get to 1,000, I will send a signed copy to some lucky viewer at random. Okay, so one last bit of housekeeping. As I always say, these videos are for educational purposes only. All right, so today we're going to talk again another video about sleep apnea. Like we talked the last time, we had mentioned Winks and Provent as kind of failed things that had kind of come and go. What I want to talk about now are some of the surgical options that you may not be aware of, okay, or that are less popular, I would say. There is the implantable nerve stimulator, okay, or the Inspire device that we use here at my hospital, which I'll make a separate video on. And I believe I probably have something on it somewhere in my channel about it, but I'll make another video about that soon. But what I want to talk about today are things that are a little bit less common, okay? And just so you know what that is, it's kind of like an implantable pacemaker that has a wire that goes underneath the skin, which controls the nerve, which controls the tongue muscle, okay, the hypoglossal nerve. And after that's implanted, you turn it on at nighttime, it basically sends an impulse so that the hypoglossal nerve stiffens up the tongue so it doesn't fall backwards when you're sleeping and cause sleep apnea. Okay, very interesting technology, but that's enough to talk about for a whole other video, which I will. We're going to talk about today is a couple of the other options that you may have heard about. So probably the most common surgical procedure that's out there is something called the UTripleP. That's a uvulo-palato-pharyngoplasty, okay, which is a mouthful, literally. All right, and what that is if you look in the back of somebody's throat, you have the uvula, that little punching bag, as it were, right? There's tonsillar tissue back there. There's a lot of stuff that can make the airway smaller. So what an ear, nose, and throat or ENT surgeon will do is they'll go in there and cut that stuff out. Okay, they're either using a laser or a scalpel, take out the uvula, take out the other residual tissue, tonsils if there's anything there. You don't need these. You don't need the uvula, by the way. Uvula just makes the sound, But basically, cut all this stuff out, and it sounds like a great thing, right? You're opening up the air space, so it should work. The problem, though, is that in many cases, the tongue is still the culprit, okay? So in a case like this, somebody gets this procedure done, they may stop snoring, okay? Because the uvula is gone, that little thing that hangs in the back, that's definitely a proponent of, that's a cause of snoring, okay? When that vibrates, that's what causes snoring. So with that gone, the person may be more silent, right? So the bed partner may be happy, but sometimes, or many times, I would say, in most cases, the issue still remains. The sleep apnea still remains. We kind of joke about it. We say that after you get this kind of procedure, you really can't eat for about 2 weeks, okay, because it's painful. So people lose weight, and that probably helps more than anything else, okay? So that's a UTripleP. The second one that you sometimes hear about is called pillar implants, Pillar implants, which, kind of like the video I made last time, they've kind of fallen out of favor. But what these are these kind of like polyurethane pillars. I mean, they're like little sticks, I guess you can say, cylindrical pieces that basically your nose and throat surgeon would implant into the soft palate all the way in the back of the throat. Okay, so what's happening there is that these polyurethane pillars are implanted into the back, and what they do is they prevent flopping around, because you're making the soft palate, which is normally floppy, stiff, okay? Again, sounds like this would work, and it can for snoring. It's actually a very, very good option for snoring. Extreme, but it can work. For sleep apnea, again, it's kind of fallen out of favor because it's not that effective, okay? But it is out there, and I've had many patients who have been sleep apnea patients for 30 years. They actually have had this procedure done, but they still need extra help, so... Again, not something you're going to hear about that often, but it is out there. Okay. The third one I want to talk about is called the MMA. Okay, not mixed martial arts, but the maxillary mandibular advancement surgery, MMA. Okay, so you got the maxillary bones, which are here, mandible or mandibular bone right here. Okay, advancement. So what'll happen here is an OMF surgeon, that's oral maxillofacial surgeon, will actually break the bones of the face in 4 spots. So here, 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 the maxillary bones and the mandible bone. And what they'll do is they'll break it in 4 places and then pull everything forward. Okay, so you're pulling basically the front of the face forward by a couple millimeters. And then what they do is they put in metal brackets and the bones actually grow together. What that does is it's creating a much bigger space here in the upper airway for the air to go. So you're basically, believe it or not, you're pushing the tongue, everything is kind of coming forward, and you're creating more space back here. Makes sense, right? Very involved procedure, very extreme in some cases, but it does work. Okay, it actually works very, very well. If you follow baseball, there's a guy named Mike Napoli. He played for the Boston Red Sox. I don't know who he plays for now, but he may still play for them. But he had this procedure done, and it cured his sleep apnea. Okay, so very extreme, but it is out there, and it can be curative. All right. So those are the 3 kind of procedures that we recommend patients get, although not that often, but they are out there. Again, the implantable device, I'll make a whole other video about that, but I just wanted to kind of bring everybody up to speed on these treatments for sleep apnea. So that's the video for today. Thank you for watching. If you liked it, please click like. Please share with your friends and family. Please subscribe to the channel. And as we get to 1,000, somebody will get a signed copy at random of the book. And I think that's all I want to say. So until next time, sleep well.